community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Welcome back to another episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor, and each and every Friday and Saturday we get together and talk about all things related to your health. And this time it is the season. And when I say the season, we're talking about none other than our annual hurricane season. Now, this is not anything new to someone who has been in the islands for quite some time, but if you're just visiting here or you've moved here in the last couple of months, you probably watched as Beryl rolled through here over the last couple of weeks and just look at the devastation that it has done in the Leeward Islands. It missed us for the most part, and then it moved over into the Yucatan Peninsula and moved on up into Texas and Galveston and Louisiana. And right now, as we speak, I just checked it, there are still hundreds of thousands of houses and homes that don't have power and electricity over there in the U.S. And I thought it might be a great time for us to talk to our, I want to say, local constabulary when it comes to the experts of hurricane preparedness and also what we can expect from our services here right in the Cayman Islands. So I'd like to introduce, you know what, I'll let them go ahead and introduce themselves so we can start here.
Good morning. Thanks for having me, Chuck. I'm Joanna Rose-Wright, Senior Nursing Officer for Primary Health Care and Public Health.
Good morning, Mr. Chuck, and to the listening audience. My name is Jayse Wilson. I am the Deputy EMS Manager for the Cayman Islands Ambulance Service.
Good morning, everyone, and I'm Colin Medford, Chief Pharmacist of the Cayman Islands Health Services Authority, and it's a pleasure to be here today.
Excellent. And later on in the show, I'm going to be also adding into the mix Mr. Simon Boxall from our establishary of basically hazard management. We're going to allow some information to come in because I think it's great that we have a roundtable talk about all the elements of it, because a lot of times we hear kind of during the event or after the event, but I'd like to kind of talk to what we can see before the event, because we are supposed to be having a very an extremely active hurricane season. Yeah. And when I say that, we hadn't had one of those in quite some time. And a lot of people, I hate to say it like this, folks, but I think Beryl was a good test of our response. We took it seriously in the past. People say, oh, we haven't had one in years. It hasn't, it's not on the foreground. They've waited till kind of the 11th hour to get things done. Mm-hmm. But now I think because of the seriousness of the season, they've actually taken a lot of time and thought and preparation. And I wanted to talk about that with our guests here today. So let me ask the first question. What is EMC? What exactly is that?
So the EMC is the acronym. It's Emergency Medical Centers. And these are centers that are set up on the island to accommodate a special situations during the hurricane or disaster.
Right.
So we have 9 EMCs, emergency medical centers, over 7 on Grand Cayman, 1 in Little Cayman, and 1 in Cayman Brac.
Wow, that's quite a big number for such a small community of ours.
Well, surprisingly, I mean, it looks big, but I mean, we would like to have more so that we can, accurately and fully accommodate the number of persons who would have the need to go to an EMC.
And when we talk about numbers, I was just looking at what happened during Beryl, just as a kind of a set idea. A lot of people really did use these shelters to the point that they thought that they were in need of it, so they made sure that they were there pretty early.
A lot of persons used the EMC, and I'm sure there were persons at the other regular shelters. In total, we had approximately 500 persons on Grand Cayman in the emergency medical centers. So that's the 7, because all 7 were open during Hurricane Beryl, which has not been for a long time.
Correct, yeah.
We have not had the 7 shelters open. So as you said, I think it was a test for us to see our level of readiness. And there were bedbound persons, there were other persons who we were happy to see that they were able to be housed at these shelters, because at these shelters we have staff who are able to facilitate and accommodate emergency situations. So we have physicians, we have nurses, we have midwives, we have mental health trained persons. In the event that there are emergencies, we can address these situations.
And that is kind of a testament to the bygone era of expecting the worst, but kind of preparing for literally any situation. I even saw that we had some people with pregnancies and things of that nature that were figuring that, you know what, it's actually better for me to be in a sheltered situation where I have emergency personnel there on top, versus being in the comforts of, folks, comfort. Everyone wants to be in the comfort of their home, but you have to kind of think of it in the understanding that maybe your home at this particular time may not be the most secure and safest place for you.
Yes, so for persons who are pregnant, we encourage them, especially in the 3rd trimester, which is like 7 months and beyond, to be in the shelter. If you're close to your expected date of delivery, you can speak with your OBGYN, your obstetrician, and it would be good if we were able to accommodate persons in the hospital, to have all these persons housed in the hospital, but we do not have that space at the hospital. However, we have these emergency medical centers. So in the event that they need to go to a shelter, it would be good for those who are pregnant, to go to the emergency medical centers, because there you would be more assured that there are persons who are trained to take care of any emergency event, or in the event we need to do a delivery.
Right. We kind of take that as kind of the obvious one. Let me just talk about somebody who is in need of oxygen situations, or people who may be slightly immobile. They may need assistance, more than one person to get around. Tell me a little bit about scenarios like that.
So for scenarios like that, we would encourage persons from very early to make contact with not only your local GP, but also make contact with your ambulance service. Make contact with us so that we can make those necessary arrangements, plans, and preparations so that we can best assist you in getting to and from a shelter. And I'll give you an example. So for Hurricane Beryl that passed us just recently, currently, we have over 94 persons who are on the list to be transported from whether it's their home to a shelter, or they might have a designated location where they might want to go to, as an example, maybe a relative's home, a loved one's home, something of that sort. So we would prefer, as you mentioned, for them to contact us well in advance so that we can make those preparations so that we can transport them in a timely manner.
That's a pretty big number to be, and folks, you have to take into consideration. I know you're probably thinking, okay, well, there's 3 or 4 ambulances. We're doing that, but take into account traffic on the road.
Correct.
Take into account people have to prepare. Maybe they want to bring their favorite pillow, their blanket.
Correct.
They're and these are real concerns that people have.
They are.
To be comfortable during a time of need, and also the stress level is high.
Mm-hmm. Yeah. So again, that's one of the things, as you mentioned, when we get there, we try our best to, inform people as to what they must bring. So again, whenever you're going to a shelter, in particular to a shelter, we want to encourage persons to bring, their water supply, their food supply. I know that some of the shelters have a capability for additional cots, but then again, we're trying to encourage persons, please, to bring
limited
your own,
space.
Correct. Bring your own cots, bring your own bed in, so to speak, because the government, and I know Mr. Simon will jump in here momentarily as it relates to some of the shelters, but we do have a limited amount of resources as it relates to some of these, comforts that we would find at home. So we're encouraging persons to please bring their own, bedding, your cots, various different things like that.
Right. When we talk of time frame, most times, I consider myself a semi-experienced hurricane person. I've been through quite a few. Time frame, what should a person realistically look at in being in a shelter?
So again, that is dependent on the storm itself. So, for us with Hurricane Beryl, we were pretty lucky, whereas Beryl tracked a bit south of the island. So we were able to allow persons to go back home roughly within the next 24 hours, give or take. Once the all clear was given, all of the persons within the shelters were for sure back home within 24 hours. Now, if we were to take into consideration an Ivan event, which most of us that have been in Cayman for quite some time, you're kind of familiar with, that's days. Okay, so that is why we always emphasize to bring the necessary preparation. So all of your equipment in the sense of your bedding, the food that you might want to have, various different things, especially if you have kids, ensure that you bring, toys, things that we can amuse them just so that they can stay occupied.
Okay.
Yeah.
Understandable. Folks, we're going to take our first break if you're just tuning in, talking about hurricane preparedness. We are in an active season. I will bring the man who literally spends the 6 months prior to preparing us for the next 6 months. I'll ask Mr. Simon to come on board and have a conversation with us. Thank you so much for tuning in. This is Chuck Taylor right here with Healthcare Today with the HSA.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
HSA's Cardiology Clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things related to your health. And there's nothing more stressful on an island than hurricane preparedness. And I say that with the understanding that it's the idea of what's coming. So we're watching all the news. Now I think we're in a better place, but I wanted to bring somebody in who has more data information. Mr. Simon Boxall from Hazard Management, good afternoon to you. Tell me a little bit about what you do for your preparedness? I mean, because you have probably 3 days watching. When do you prepare, and how do you prepare for an impending hurricane?
Interesting question, Chuck, and thanks for having us on the show. So I recall back to Hurricane Ivan, and I was not working for Hazard Management at the time, but I was pretty aware of what hurricanes are capable of doing. So I sealed up my doors with silicone. I had towels at the base of all my sliding glass doors as well to try to impede the flow of water. I switched off the mains water, and I had a large cooler completely filled with ice. I had 7 cases of bottled water. I think a lot of people often underestimate the amount of water they're going to need. So a gallon of water per person per day for a family of 4 is about 7 cases of water. I managed to get my children off the island. I was fortunate in that situation. I had an infant, and my wife, they went off island the Wednesday before we really sort of started to face the winds on the Saturday. So standing by in Florida, waiting to see what was going on. It's not a great environment to be in if you've got a tiny little child, obviously. So that had a role. But I was in a position. I had a little bit of cash. I had my vehicle make it through. A third of all the vehicles were lost. I was aware of the potential of the storm surge. So I'd kind of figured out, okay, well, I don't want to park my car under like imported trees and things like that because they might come out of the ground easier. I picked a nice open area, somewhere kind of like the agricultural ground type situation. So I was in a fairly prepared state. I had all the things like the flashlight. I had a jacket to wear. I had a good pair of strong boots. I had some non-perishable food and water and all these different things. Nowadays it's a bit different because I'm going into the National Emergency Operations Center. They have the stores of emergency food and water there for us so we can focus on doing our jobs and helping the community. But, I'm still very cautious of my vehicle. I'll never forget, the equivalent of 100 million vehicles in the U.S. getting destroyed in a 24-hour period, like a third of all the cars, and people are waiting months and months and months for a car. So, I had a generator. I had a lot of things that enabled me to be support to other people. And so I was able to operate and do security outside the bank because there was a bit of a kind of a panic, I think, in the aftermath. So because I had got myself in order, I was able to
help others.
And so many people were kind of struggling in that phase. And the fact that I had the cooler, I was able to empty out everything out of my fridge and freezer as the prolonged power outage occurred. And it was a very strange time because I think about 10,000 people left the island prior to Ivan, 5,000 in the most recent event, Beryl. But then another 10,000 left in the 3 weeks following it. So about half the population at the time, 42,000 people left. And so that has an effect on your economy. And mental health was an issue.
Right.
We're dealing with 2 years worth of garbage and debris. It was, roads are fairly impassable. No traffic lights work. It was quite chaotic.
I think one of the things that all of these bits and pieces of information has led us to understand is preparedness is the key. What happens if we need prolonged state in literally limbo? What happens then? I think, because we're a very tech-savvy country, we have, relied on certain things more so than others. How do you get around what happens when you don't have internet? How do you get around what happens so you need to know where to go to get things. You need to have a radio. You need to have what my mom called old school information.
True.
You need to know how to get to a secure location, how much time you have. Roads are going to be, impassable. What happens then? You can't drive certain types of cars, and when you hitting, hydroplaning in water, I remember people trying to drive during the weather And I'm like, you shouldn't be out during this time at all. You should be in a secure location. So we need to kind of reinforce these ideas because people haven't been through this before.
It's so true. And as you point out, that source of information is very vital. The small radio, that sort of, you don't think of it as being that important, but those relief distribution sites that are set up quite often next to the shelters, providing food and possibly water for those that have none, giving you an idea which district clinics are open. You imagine you set off down the road from the town of East End and you're an old person, you walk to the district clinic and then it's closed. Well, if you found out in advance on the radio, but certain things became very important to us. Having a can to carry gasoline was very important. The electrical plugs, extension cord, when many of us found the generators, to use. And it's a very difficult environment. The shelters were open on average, I think, for 40 days, which impacted schools greatly and parents, and particularly single mothers who were juggling jobs, putting their house back together, and then trying to, take care of their children in that environment when school was out. So there's a lot to think about, and I think we are a lot more resilient, more robust. There are better mechanisms in place to support people. But that period of preparedness is so important, and I think particularly for the frail elderly, whose senses of smell and hearing, and touch even, and we're not as mobile, walking around, stumbling around in the darkness, we know it's very difficult for them, and the mortality rates tend to increase. So if we can look out again for the frail elderly, and they do so much good work at the HSA to support, but a welfare check, a bag of ice, a bottle of water, these are heavy things for an old person
to be lifting. And so you really need to have a game plan for your elderly folks within your family members, because you yourself may not be able to do that. So what happens if you are immobile at some location? Who's the next person down the line? Are they with you? You really need to have those. And I just want to kind of make a leeway to Mr. Colin Medford over at the HSA. Talk to me about preparedness from the pharmaceutical part of it.
Well, obviously, when you talk about pharmaceuticals, you're speaking about the continuation or continuum of health. It is, as we were referring to Ivan, one of the things we realized during Ivan was that persons came to the hospital and they got large amounts of medication. And in doing so, they took it home, but quite a bit of it got lost in the storm, flooding and so on. People just lost their meds. And the minutes after we reopened, perhaps on the very first day we reopened the pharmacy, we had a massive crowd of persons just waiting, some of them who had already gotten their meds, waiting to collect refill again. And then we had all those persons who would normally be in the private sector, everywhere else was closed. So they also came to get medication because they'd lost theirs as well. And what we learned from that was that giving persons huge amounts of medicine prior to an event is not a wise thing, because first of all, it depletes our stores, it depletes our supplies. And in some cases, some persons had medication at home and they still came to get in excess of what they had at home. So you've got persons now who are stockpiling, and that puts other persons at a disadvantage because they come to get the same medicine, but we can't give them because other persons have already stockpiled it at home, and there's no way we can ask them to bring it back. Or I mean, that's unheard of. So what we do now is we try to be proactive. We ask patients to be proactive, to ensure that they have at least 2 weeks supply of medicine on hand prior to an event. And this medicine is supposed to be kept in an airtight, perhaps Ziploc bag, if necessary, whatever size they need to get. They need to keep that medicine for the entire season and only use it if an event comes along. If that happens, then they'd have to replenish it afterwards. But they keep it for the entire season, and at the end of the season, instead of coming in for refills. And I must say This refers mainly to persons who are taking chronic meds, persons who are diabetics, hypertensives, asthmatics, epileptics, even persons with cancer medication.
Okay.
And so on. Those persons, we ask them to ensure that they have a supply on hand, at least just 2 weeks, because we believe that it gives us enough time to get back into our services. And also 2 weeks would be sufficient for most people to get some of everything that we have. One of the things we try to tell patients is that we've got proper storage at the hospital. So in case something comes along, it is highly likely that we would be able to store medication much safer, so that when it is needed after the event, we'd be able to disperse it to patients, and also in sufficient quantities that they would be able to help them until we get additional supplies or until we get relief.
Okay. I guess part of the information that I would love for our public to understand is that you have started an implementation of things just in case, so that they understand that, you know what, a lot of people, I remember there was a run on Ziploc bags, and they were talking about, Ziploc bags, here's what you're going to do. You're going to write your name and your phone and all that information, so that you know when you got this medication, when you stockpiled it, to save just in case for the 2 weeks. And that way this was to be left there, and this is stuff, and I hate to say it like this is stuff our younger folks need to help our elderly with, because they may not be able to get to this specific additional stuff to put down and have it in a secure location, or say, you know what, hey, I have it in a storage container in a blue bag. These types of things, we really need to come together as a community to get through all of this, and that's the thing I think that we really need to understand.
Yeah, that's why it's important for it to be done early. Now, we had a situation week before last where we were inundated with persons coming for refills. One of the things that we want persons to understand is that rushing in when you get a warning, or when you get a watch or a warning, at any of those stages or phases, it puts a lot of burden on the pharmacy, because it decreases our safety. It decreases our ability to see after each patient individually, simply because of the rush. Now, that rush is also not necessary for persons who have already gotten like a month's supply just a week ago, and they're coming in to get additional supplies. We wouldn't supply those persons with additional meds because of what I just said. We'd be stockpiling,
right,
and putting other patients at a disadvantage. It is necessary if you've already gotten your refills and you know you've got 3 weeks at least, 2 to 3 weeks at least at home. It is necessary for you to ensure that you secure those, and ensure that you do exactly what we just said. Put them in the airtight container, bag, or bin, or whatever you have, and make sure that they're with your emergency supplies, your personal things. As much as possible, keep them as close to you, so that when you're grabbing and running and so on, you wouldn't leave them behind.
Okay.
But the other thing is that what we realized as well is that there were persons who were calling who we had not seen for 6 months, and now they're calling for refills. It is dangerous for us to give refills in those situations, because
you don't have a backup of the medical.
But they also need to see the doctor,
yeah,
because after that time, you just don't know what changes have taken place.
Prior to hurricane season, you should have a complete mock-up. You should go see your doctor. You should go see your GP. You should be aware of what you are going into hurricane season. And responsibilities, yes. I wanted to talk to Simon over at Hazard Management. Seeing that we've just gone through our first one, and you've worked out all the kinks and all of the things, and you see how the public has reacted. What's your assessment going forward?
Well, I think it was a very good response. I think 1,000 people were in the shelters, so people are taking it seriously. I'm sorry, Colin's team at the pharmacy experienced a rush, and hopefully that won't happen again. But I think obviously we were quite effective in the communication, getting the word out. We had quite a lot of notice. We don't always have that amount of notice, and again, we didn't take the full impact of Beryl past. So there's still a possibility that we could be facing an actual severe impact.
Direct hit.
So St. Vincent right now is dealing with, I think, 14 of its medical facilities seriously damaged. Over 100 of its healthcare workers who, suffered damage to their properties. 11 fatalities in St. Vincent. I do think we, in some respects, are quite well prepared. Every single one of our healthcare workers, as a license requirement, has to go through preparedness seminars every year. So they're aware that they need to show up to work and perform the function that is expected of them. So their personal preparedness is very important, and hopefully that's all in place.
Okay.
But I do feel like Cayman is taking these situations seriously, and they recognize particularly the storm surge, the flooding elements. People are seeing flooding as an increasing issue, but the threat of the waves, the threat of the storm surge is serious. So I'm very glad to see people going to the shelters and getting out of harm's way. And yes, we were fortunate this time. I hope they don't get complacent as a result, because the next one could be different. So cautiously optimistic, I think.
Okay. Excellent. Folks, we're going to take our next break right now. When we come back, we're going to talk to our folks over there at EMS about what you can kind of do to prepare for a storm. We talked a little bit about expectant mothers, but I want to talk also about dialysis patients, things of that nature. Kind of get a little bit deeper, because we have a very robust healthcare system here, and we wanted to kind of shed a little light and also give you instructions on what to expect as we move into a deeper and more robust season. Keep right here. This is Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday we get together at 1 p.m. and talk about all things related to your health. We'll be right back.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Welcome back to Healthcare Today with the HSA. I'm your host, Chuck Taylor. Each and every Friday and Saturday, we get together and talk about all things relating to your health. And this time, we're talking with our friends over from HSA and also Hazard Preparedness about hurricane preparation, what it takes in light of preparing for hurricane. I know there's a lot of moving parts, but specifically, we wanted to kind of zone in on the shelters and also what are exactly the requirements with it. EMS is required to servicing the public beforehand, and when shelters open, once again, go ahead and introduce yourselves to our public who are just tuning in.
Okay, good day. My name is Jayse Wilson, the Deputy EMS Manager for the Health Services Authority.
Joanna Rose-Wright, Senior Nursing Officer, Primary Health Care and Public Health. Good day.
So with that being said, talk to me a little bit about moving forward with the EMS and getting people aware of what your requirements are as we prep, because I know a lot of people are aware, when a hurricane warning, all of that. Tell us a little bit about that.
Okay, Chuck. So as we kind of briefly touched on earlier in the show, so our preparedness actually starts well before the hurricane season itself. And matter of fact, this is something that we continue to do all year round. And this is where the EMS service, we are constantly in communication with Nurse Joanna Rose-Wright and her team, because they continually provide us with updates as it relates to potentially the most vulnerable persons within our communities. Now, when we have a compilation of that list, normally when the shelters are activated, which is normally 36 hours prior to the storm itself impacting our islands, this is where we would kick into high gear, and we would be transporting those persons, whether it's from home to the shelters, or if it's from their home to maybe they have a designated area, another designated area or location. Maybe it's a relative's home or somewhere else that they have made other accommodations to.
Oh, so you actually help them if they say, okay, you know what, I have a cousin in so and so district, I stay with them. You actually help with the
correct
movement?
Yes.
Oh, okay.
yes. So that is a part of the service that we offer, because we identify some persons. They might say, hey, listen, I'm not in need of going to a shelter, just my home. It might be in a low-lying area, or maybe the structure itself, they're not 100% confident. We will be able to transport them to a relative's home. And believe it or not, for Hurricane Beryl that just passed us, we had a significant amount of persons that said that. They said, basically where we're currently staying, it's in a low-lying area. We're getting information that is supposed to be a little bit of rain, some flooding. We don't want to stay here. However, we don't think we need to go to a shelter at this point in time.
We don't want to use up the resources for some that could be for someone else who's dire in need. Okay.
Yes. So those are some services that we do in fact offer.
Excellent. And it's good for the public to know that. And also, I wanted to say, during the times of people staying in shelter, privacy may be an issue. How do we take a look at that?
So one of the things I'll pass that over to Nurse Joanna in a second, but as it relates to some of the items that we, would encourage persons to ensure that they have when they make contact with EMS. So we're asking for any and all persons who are even if we don't have you currently documented on our list, still please reach out to our public health department or reach out to our primary health department, and they will be able to, have a conversation with you, determine certain factors, and find out again what your vulnerability status is. Okay. And if you're deemed to be one of those vulnerable within the community, absolutely we'll put you on that list, and we'll have our EMTs, our paramedics, and our transport crews go out and collect you and then transport you to the necessary location, whether it be at a shelter or to another location.
Okay.
We would ask persons though, just as it is published on the HMCI website, we've had these things published for many, many years. Things such as, 1 gallon of water per person per day. Ensure that you have your own portable cot. Unfortunately, we don't have the capacity at this time to transport hospital beds. However, if you have a foldable cot, we can fold that up for you. Your bedding, different things that's going to make you more comfortable, or your vulnerable person more comfortable in that shelter. Please ensure that is packed, that is prepared. Mr. Colin mentioned it as it relates to their medications. When they're there, nothing is just going to stop, right? Things are going to continue on. So if you have to take, as an example, your blood pressure meds for the day, your diabetic medications for the day, ensure that all of those medications are packed. Ensure that you have all of your appropriate documentation, because again, we don't know what could happen, right? We could go from, hey, we can have a barrel which literally just skims the island, or unfortunately we could have an Ivan which we have like a full-on impact, and it could devastate.
So have all your documentation there, whether it's passport, birth certificate.
Correct.
Even I know some people even have their medical files and things of that nature. Have all of those in a dry container, folks, a dry place.
Yes. And then we will be able to take those with the person to the shelter. Now, as it relates to privacy in the shelter, I'll go ahead and hand that over to Nurse Joanna.
Thank you, Jayse. And I'm going to continue on. You were saying about taking medications and other things to the shelter too. It's important because if we have to take care of a health situation in the shelter, it's good for us to see your documents, to see what medication you're on, what is your current situation as it relates to your health. We know that there are some persons who are not comfortable going to the shelters because they are fearful of being exposed. So many persons are going to be seeing what is happening to them. We try to ensure privacy at the shelters using privacy screens and provide cots so that person, especially those who are bedbound, they're able to have somewhere comfortable to lie. However, when we look at our situation, especially with Barilgo, I've been to all the 7 shelters during when they were open, and I realized that we were short of cots and also privacy screens. So I was at one of the shelters when the caregivers were, doing baths, and I realized that, in some situations we had to wait for the privacy screen to be available. So that's one of our challenges. Okay. Also, wheelchairs. It would be good for us to have wheelchairs, even one in each of the emergency medical centers, because this will allow us, in the event of an emergency, to move persons to an area of privacy where we can take care of them. We encourage persons who are coming to the shelters who have caregivers at home, that their caregivers are to be with them in the shelter, and it is important to take their medication, because we don't administer medication routinely at the shelter.
Exactly. So it's best for them, folks. And I tell this over the years. Make a simple chart of what you're going to take with you. A little checklist, it could be on a paper, it could be that, but you know exactly what you're going to be taking during hurricane season, because there may be certain shelters, and I'll come to this, that accept dogs and some don't. So some accept them, and so you need to be aware of what you're going to be moving with. Make sure your cell phone is charged, make sure you have a charger. Those are the things that people forget in haste. Yeah. And they always, oh man, I forgot this. And it could be something as simple or as major as medication. Yep. And then you're stuck. Because the rule of thumb is once those doors close, you are not allowed to leave until we get the all clear from the government. Right. So, and even that, our friends over there at EMS, they're not allowed to come out on the road during a hurricane, no matter what the cause is. It is illegal for that to happen. So you really need to plan and be prepared for sitting down and kind of enjoying the camaraderie of your people in that shelter, because that's where you're going to be.
Yes, and just in case some persons, persons are careful as to protect their medication. So they may say, my medication has to be in the refrigerator. So when I go to the shelter, what am I going to do? All the emergency medical centers have small refrigerators. Okay. And once we get there, we would identify those persons who are on medication that needs to go in the refrigerator. So if that is someone's worries, we don't have to worry about that. That is taken care of.
I'll tell you, my mom's 87, so she's been through quite a few hurricanes, and she says, one of the things that she likes to do is she'll say, baby, go take a picture, photocopy, and she'll put up her picture on the Ziploc bag with her name, phone number, and who she is. She said, just in case I can't talk, they can see who I am. Yeah. And then, and I always, growing up, I was like, oh, Mom, but then I realized how important that was, because you may not see the same person over and over in the shelter. Yes. It may be somebody else administering the medication to you. It may be somebody else who may not be able to say your name properly. It may be because we have a lot of different nationalities here. Yes. And so you really need to take these things into consideration and kind of be prepared for it. And I'm just tossing that in there. I know, we have a lot of great ideas, but
that's good.
It's always the little things. And I wanted to kind of do a little shift and over to Colin. As far as medication, I know pharmaceutical wise, how difficult is it prior to hand? Do you take assessment, say, okay, do I need to say this is just for a hurricane season? Do you do things of that nature?
We obtain supplies, especially for the same emergency medical centers. We obtain supplies for them which are essential meds, which go over to each emergency center. So they would have a supply of medicines in the event of most emergencies, and that would include things like persons with severe pains, lacerations, diabetes, diabetic emergencies, and several other. Even in the event of a pregnancy, we send over meds which will be used to affect the smooth delivery of an infant.
So
those kits are kept on an annual basis. We rotate the meds in those kits on an annual basis to ensure that everything that is in there for the season is in date and it has a good shelf life.
Okay.
So that when we cover those kits down, we can guarantee that the meds that are going to go out during event or at the warning stage, when the event is pending, we have them sent out along with the medical supplies to all of the emergency centers.
Okay, excellent.
And that is I can say that's a well-oiled machine, because we do it every year, and we're ready for it from May.
Okay.
Before the storm.
Well, prior to the season.
Yeah.
And I think the seasons change so much over the course of times. We've I think, and I just tossing this out there, Beryl is the first one that we've had so early in the season.
Yeah, that's
so and if I can just bring Simon in here, and then we can get set to start wrapping up. I know we talk about an active season, and I'm looking at the names and all of that, and I'm like, wow, the attitude from the National Meteorological Society, they've given us all of this, saying that it's a pretty busy season within our Caribbean. Tell me a little bit about that before we take a break.
Yes, the conditions with La Nina transition to El Nino, the Enso cycle, where it reduces the vertical wind shear. We also have very warm sea surface temperatures, and water being warm, deep water being the fuel for hurricanes. All the conditions are kind of right. The El Nina pushes the Bermuda High up a little bit, and that causes typically a little bit more activity in the Caribbean Sea as well. But I think everyone was quite surprised and stunned really to see a Category 5 hurricane churning through the Caribbean so early.
Yeah.
And,
generally later in the season.
Later in the
season that we see, and you never know.
No, you never know.
You really never know. So you have to take it all as it's going to be pretty bad.
That's right.
No matter what it is, because the only good thing I say is we have time to see this building. It's not like in the U.S. I've been through tornadoes, earthquakes. Those things happen instantaneously.
Right.
There's no place to run. There's no place to hide with some of those things. Here we have a little bit of time to look and assess and basically prepare.
I think that's absolutely right. I mean, a lot of the things that people have lost in past hurricanes, I think in Cayman have been avoidable to a large degree. You can back up your data, you can get your car safe, you can do things to protect your house a little bit of maintenance here and there might make all the difference to your roof and things like that. And I do think we are just generally a lot more prepared and ready, and Cayman is very fortunate. We've got very strong buildings.
Yeah.
Again, it's just the water's the issue.
Yeah, I always look at our building code, and kudos to the inspectors over the years. We have very strong buildings compared to some. I looked at some of the stuff in Louisiana and Texas, and I'm like, is this America or somewhere else? Because I'm blown away by how the house disintegrated with that, and I wasn't there, mind you, but just looking at how the house had literally come apart, and I'm thinking, we don't have that here in our
now
region.
It's 60-mile-an-hour winds basically tracking through Houston in Beryl, so that wasn't even hurricane force winds. I mean, it's an incredibly densely populated, massive metropolis. So, it just all adds up. A tree here, a tree there, falling on a roof, a car, whatever. But it's into the billions. But I do want to thank you again, Chuck, and DMS for always kind of bringing us on, trying to get the word out, trying to help people, encourage people to prepare. I know a lot of people listen to your channels, and it makes a big difference. And we're seeing it like in situations like with Beryl. People are actually responding and getting ready, and a lot of that is down to the efforts by you guys. And so thank you, as always.
Exactly. Thank you so much. And just in wrapping up the final statement.
So thank you, Chuck, for joining with Simon. Thanks for having us here to get the information out. If persons who are on dialysis or chemotherapy, you get in touch with your unit once there is an impending hurricane or disaster. And other persons, if you're on oxygen, you have chronic diseases, we encourage you to go to the EMC. We are there and we are staffed for you.
Thank you very much again, Chuck. Thank you to the DMS team here for allowing us to come on. One final note from your local ambulance service. We want to encourage everyone to, in fact, be prepared. I know this is something that we have said throughout the entire season itself. In the event of a storm itself, unfortunately, your ambulance service will not be responding. Your emergency services will not be responding. So that will be your blue light agencies, so police, fire, and EMS. So we're asking for you to please make plans and preparations ahead of time if you feel like you're in a vulnerable area or you yourself you're in a vulnerable position. Please make your way to a shelter, and if you would like transport to or from a facility or whether it's to another location, please contact us, that is your local ambulance service, or make contact with your local GP or public health or even primary health care so that we can collaborate together to ensure that you are appropriately transported, whether it's from home to the shelter, and we can get you back home safely.
And I think, Jayse, that would also apply to persons who are in the flood-prone areas where
Correct.
they need to make preparations to get out, especially those persons who have experienced it before.
Correct.
Just need to take caution just in case. Chuck, thank you so much. We really appreciate being here, and especially the ability to get this information out to the public in such detail is very important. Lots of people don't read a lot of things nowadays, but getting it on the radio and hearing it spoken to them, I think, makes a big difference. One of the things I wanted to piggyback on also with Joanne are those patients who are coming to the oncology day unit as well. There are some patients who go there on a weekly basis, and they would need to know what to do as far as getting their meds are concerned, especially since they're on regimes that demand that they take it every week. So those patients would need to consult the nurses at the oncology day unit as well to get any information regarding what changes will take place or what alternatives they'll have to make in order to get their meds.
I want to thank everyone for coming by here today. And just a reminder, at DMS Broadcasting, we've want to put out the information that we are here 24 hours for you, and also to all the services if you guys need to get information out there. You know, in Beryl, we tested a system that we thought would be great, and we realized that it did work, which literally linked all of us from various locations around the island on one radio station to broadcast on all 7 of our radio stations. So, you know, we got good feedback on that. It looked pretty good and sounded good, and we are there just in case any information needs to go out there from any shelter or anything like that. We implore you, make sure you have our contact details that we can always get the information. And you, the public, be prepared. I can't stress that enough. It is your responsibility to make sure that your household is good. And when I mean good, medication, car, all of those things, if you need help, we're here for you. But you need to make the initial step to say, hey, this is what I'm looking at. You know, I live in a flooding area. How can I prepare myself? We are here for you. Keep right here as we roll through. This is Bobo 89.1 FM. I'm Chuck Taylor, and this is Healthcare Today with the HSA. Each and every Friday and Saturday, we talk about all things related to your health. Be safe, Cayman.